The commonest signs of polycystic ovarian syndrome. PCOS signs, PCOS symptoms. In this video, I'm going to answer this question. So, polycystic ovarian syndrome is a hormonal condition. It's a hormonal disorder. It is a condition whereby a woman specifically tends to have hormones not balancing. And when I'm talking about hormones, remember hormones are chemical messengers. So, in this particular scenario, polycystic ovarian syndrome, also known as PCOS, a woman has hormones which we call the male hormones. They are actually very high. These male hormones, also known as androgens, specifically the hormone known as testosterone, tends to rise. Remember, this male hormone, testosterone, in a woman, it is actually produced from a woman's ovaries, and then also on the top of her kidneys there are two small glands known as the adrenal glands. They do also produce some little testosterone, but ideally a woman is not supposed to have very high amounts of testosterone. If something happens and maybe this particular woman, the hormones tend to begin like they tend to fluctuate, and then the male hormone, also known as testosterone, rises, and it becomes actually much more higher than the normal, then this particular lady could actually be having what we call hyperandrogenesis. Hyperandrogenesis simply means that the androgens, the male hormones in this particular lady, they are actually so high. What could have caused this? Many causes of PCOS do exist. So I was talking about hyperandrogenesis, and specifically I've said that this actually means that this particular lady has high amounts of the male hormone known as testosterone. Now, when testosterone hormonal levels are high, what is going to happen to this particular lady? What is going to happen, what we call the signs and symptoms of PCOS are, number one, there's going to be what we call hirsutism. Hirsutism simply means that there's going to be lots of facial hair. There's going to be beards in this particular lady. There's going to be hair around the chest. There's going to be hair around the back region. Okay? Then what is also going to happen is that she could actually end up having what we call acne. Then the other sign of PCOS, the other symptom of polycystic ovarian syndrome is that when she goes to hospital and the doctors do what we call a pelvic ultrasound scan or a transvaginal ultrasound scan, it could actually show that either one part of the ovary or both the ovaries are having lots of small swellings. We call these cysts. And when there are many, this is actually what is known as polycystic ovarian syndrome. Now, if you are asking yourself, is this a sign of PCOS? Yes, if there are many swellings over 12 in number on each of the ovaries or on one of the ovaries, we call these polycysts. This is actually one of the signs of PCOS. I've talked about lots of hair. I've talked about the male hormone testosterone rising. This can actually be confirmed after a blood test has been done to really ascertain and confirm how much testosterone is in her system. The other sign of PCOS is that there's going to be a very thin, moist skin. A woman with PCOS tends to have skin changes. The skin could actually be very moist. It could actually be very, very thin, and she can actually easily get injuries. The other sign of PCOS, this can be seen on an ultrasound scan, is that the inside of her uterus, we call this the endometrial lining. Remember, the normal is supposed to be between 0.5 centimeters to at least. So the inside of her endometrial lining could actually swell. It could actually become so big. We call this endometrial hyperplasia. If you go to a hospital and they do an ultrasound scan on you, the doctors do an ultrasound scan on you, and the ultrasound scan shows that the inside of your endometrium is actually very big. It's actually very thickened. This is actually what is known as endometrial hyperplasia. One of the classic presentations of PCOS. So in this video, I've been talking about the signs of PCOS. I will summarize again. I've said that when a woman is to be told that she could be having PCOS, there's going to be lots of facial hair. But remember, there are other conditions that could cause this. You need to confirm with your doctor, who will run the appropriate tests, and then a diagnosis will be made on you, and then treatment will be given. My videos are for educational purposes only. PCOS signs: there's going to be lots of facial hair, there's going to be beards, there's going to be hair around the chest and around the back. There's going to be acne. We call these pimples, which would actually, ideally, some women get pimples around the time of periods or even after periods, but in PCOS, the pimples tend to just pour in and they do not actually go away, whether she is in her periods or she's not in her periods. So there's going to be pimples that will be distributed around the face. The other sign of PCOS is that there's going to be changes in her ovarian distribution of the follicles, or there's going to be lots of small swellings which are on her ovaries, also known as the eggs, and these follicles don't grow. They remain small, and that's why they are called cystic follicles. They actually do not grow. We know that in normal circumstances, when you take a closer look at a woman's ovary, the ovary is that big stuff that houses the eggs that grow to actually become fertilized. The ovary is that big tissue which carries the eggs that actually become babies. So in a woman with PCOS, instead of having an egg going through the three stages, the primary stage, secondary stage, and the dominant follicle coming out, getting fertilized when she's with her partner, and then that egg that has been fertilized becomes a baby. In a woman with PCOS, there's going to be eggs that are very small, but they will not grow. And that's why they are called cysts. When there are many, they are called polycysts. So the other sign of PCOS is that this actually could be a complication of PCOS if it is not treated in the long run, in the long term. PCOS or chronic PCOS could actually lead to what we call metabolic conditions or metabolic disorders. It could also predispose a woman to heart conditions. So when a woman has PCOS and it has not been managed, it could actually end up into a complication whereby she could have what we call a heart disorder, heart disease. It could also predispose her to a metabolic syndrome or a metabolic disease, also known as diabetes mellitus, specifically type 2 diabetes mellitus. Why? Because in PCOS, there's going to be insulin that will be produced, but because of the rising sugars, due to the condition PCOS itself, because of the rising sugars not being utilized by your body, the sugars will actually overpower the insulin, and then of course the body will refuse to respond to the effects of insulin. Remember, insulin is actually a hormone that is responsible for controlling the glucose in our system. Insulin is a hormone that actually converts or brings about the conversion of glucose into energy stores known as glycogen. Insulin is a hormone that is actually very responsible for converting glucose into energy so that you can be able to do your daily activities. When a woman has PCOS, insulin is going to be produced, but the body will not actually respond to the effects of insulin. I'm called Gerald Massa, and I'm a natural fertility coach, a natural fertility stroke PCOS coach. So if you are having questions about fertility, if you are having questions about PCOS, Polycystic Ovary Syndrome, and you would like to talk to me about this, you would like to join my coaching program, maybe consult me for like 45 minutes or even for a whole month, Saturdays, or even 2 months. It's very easy. You can actually check on my bio just up here, just below the numbers, the WhatsApp numbers just below. You can actually click on that link. It's called Gerald Massa Global Fertility Coach, and then you'll be directed on how to do the booking. It's very easy. We can work together. Remember, you can move from PCOS to pregnancy. My videos are for educational purposes only, and let me see you in the next video. Thanks for sparing some time and learning something about the signs of PCOS. In the next video, we shall discuss more about PCOS. What foods are you supposed to eat? How can you track your menstrual cycle when you have PCOS? And how can you boost your levels of which supplements are you supposed to take when you have PCOS? Because there's lots of information out there, but I will be able to bring out the best information for you so that you can know that if you have PCOS, then this is what you're supposed to do. Let me see you in the next